I will pass it along to Katie Nearing to discuss roadshows regarding the Older Adult Research Specialist Group.
Good afternoon, everyone. I'm Katie Nearing. I'm an assistant professor in the Division of Geriatric Medicine and the principal investigator for the National Institute on Aging Research Infrastructure Award that's funding research roadshows. And I appreciate the opportunity to share a bit about these research roadshows, and hopefully by the time I'm done, you and your research teams will want to join us on the road. So just, I want to start by trying to create a visual for you. I want, first of all, to invite you to erase from your mind the typical image of a research team sitting at a community-based event at a table with flyers and various materials that they're handing out. With these research roadshows, our goal is to really respond to adult learning theory and make these opportunities to be for older adults, particularly to interact and engage with research. For many, this may be the very first opportunity that they've ever had to really learn about research, to have the opportunity to learn directly from researchers about what they're learning from their research and what it means to me and my health. And so we really want these research roadshows to create that bridge for, in particular, older adults to have that opportunity to learn about the variety of types of research and clinical trials in particular that we're doing on this campus, what it means to their health, and to also help people have an experience that lets them know that they can participate in research. There are opportunities to participate in research, and we want to build those bridges to help them do that. For you all and your research teams, we hope that these events, these research roadshows, create an opportunity for you to recruit and enroll study subjects, and particularly those who may be relatively underrepresented in your research. So with that, hopefully, as we go along, I'll continue to create the picture in your mind of what we're really trying to create with these research roadshows. Is very experiential, very interactive, very hands-on, with lots of different types of supports for engaging older adults in research. And meeting them where they are, regardless of their readiness to participate in a clinical trial. So I want to acknowledge the funding support that I have, that we as an institution have from the National Institute on Aging for this Research Infrastructure Award, which is focused on promoting the inclusion of older adults in research. With this 3-year award, we have 2 specific aims. The first is to train and promote the hiring of older adult research specialists. So these are older adults who are trained as research navigators to support the recruitment and retention of peers for clinical trials. That's our first aim. And the second aim is to engage populations of older adults in clinical trials through innovative outreach and engagement strategies, the research roadshow being our primary strategy. So why are we focusing on older adults? Older adults are a population that are underrepresented in clinical trials, even clinical trials focused on health conditions that are most prevalent in older adults, or that may have particularly devastating health consequences for older adults. And if you think about clinical trials, for example, leading to a new medication, and all of the medications that older adults may be prescribed. We recently did a chart review with the VA where older veterans were prescribed an average of 14 medications. And that was just a specific subsample of older adults that we looked at. So when we don't have older adults included in those clinical trials, we don't know if the products of that research may be safe or beneficial for those populations that are not included. So again, this is why we're focused on older adults and trying to create bridges for participating in clinical trials. We also have this new directive from NIH that came out in 2019 that requires that we provide scientific or clinical justification for age-based exclusion criteria. So without that justification, we must be enrolling older adults, and we must have effective ways to reach populations of older adults. The same year that this policy, NIH published this policy or guidance, we looked at how we were doing in terms of enrolling older adults, and what we found is only about a quarter of our adult clinical trials had enrolled even one adult over 50 years of age or older that same year. So we knew we had a lot of work to do. So clearly we have a moral and scientific imperative to make sure that we are doing a good job of reaching and enrolling older adults, including older adults in our clinical trials. Why are we traveling the state with these research roadshows? In Colorado, I know that a lot of our work is concentrated in the Denver metro area or the Front Range. But the rural populations are another population that are underrepresented in clinical trials. And so if we want to increase the generalizability of our results, we need to also consider geography and geographic diversity. There's also the intersectionality of rurality and age, such that we see a concentration of older adults in our rural areas, and Colorado is no exception. The 10 counties with the highest median age in Colorado are all rural. And this map that I have from the state demographer's office shows these dark regions of our state. These are regions that we've experienced an increase, a 75% or greater increase of older adults over the last decade. So clearly we have a tremendous opportunity in Colorado to engage populations that are underrepresented in clinical trials in our research to increase the generalizability of our results. So again, to help you formulate a picture or visual in your mind about what these research roadshows look like, I wanted to share with you a few pictures and some examples of teams. And if you're asking yourself, who would travel to go and take part as a research team in a research roadshow, it's really anyone that's eager to find new ways to reach and connect with populations or groups that are underrepresented in your research. And to give you a sense of the range of different types of studies and study teams that we've had participate with us, I'll walk you through a couple of examples and pictures here. So top right is the team from the Center for Inclusive Design and Engineering. They've participated in every research roadshow. We've had really 3 thus far. We did some initial pilots, but I'll count 3 so far. And they have used these research roadshows as an opportunity to get feedback on new technologies and devices that they've created. So what you see here is this team engaging a couple in doing some user testing of a voting app to support continued civic engagement of older adults who may have a difficult time getting to the polling place, for example. So they're collecting feedback from that couple there. We also have in the opposite top corner, left-hand corner, top corner is Ryan the robot. This is a social emotional robot that also has made an appearance at our Age Tech Research Roadshow. And again, this team received feedback from individuals who were interested in perhaps having some this type of technology support to provide support for a caregiver of a patient with a memory issue, dementia. So this team here at our last Research Roadshow got feedback from 26 individuals. If I move here to another user testing experience, so these are experiences where older adults can actually have a firsthand experience of engaging with research and experiencing how their participation, their feedback directly shapes a concrete product. And we hope to parlay that kind of experience and that realization of how my participation can really make a difference in how a product of research, the degree to which it may be beneficial for someone like me, we hope to parlay that as a key message that we keep repeating and reinforcing throughout. So with this user experience or hands-on experience participating in research. This is a physical therapist turned engineer who created Steady Play, which is a way to for us all to have fun as we are doing balance training for fall prevention. And so as you adjust your weight on this board, it directs a car around an obstacle course. So you can imagine this particular research team and experience always has a long line at our research roadshows. And our last research roadshow was about 4 hours, and she engaged 11 people all the way through her 30-minute research protocol. And then finally, I want to highlight another study team that's been with us who actually, because of their particular research design or protocol, are able to enroll participants in their trial. And their goal is to enroll a total of 30 in what they have described as a hard to enroll study. And over the course of 3 research roadshows that they've been with us for, they have enrolled a total of 10 people. So a third of their accrual goal. So I hope that gives you a sense of the variety of teams, the variety of experiences, and how that's supported recruitment. We do want to create an experience that leads people from increased knowledge to intentions to participate in research and to offer a variety of supports along the way. So I mentioned the user experiences. If that creates positive outcome expectations about the impact that I could have through my participation in research, they can engage with at the research hub with research teams who are there to recruit and enroll for studies. And one of the things that we also do at our research roadshows is provide guided tours of our research studies website. I'm sure you all are all familiar with that website, which features all of our actively enrolling clinical trials on our campus. And we, based on participants' interest, topical interest, we show them how to find the research studies website, how to do a search based on their topics of interest and find clinical trials that they may be interested in participating in. And we also help them understand what information is available on the landing page when they've gone to a particular studies page to learn, to find information about who's eligible or eligibility criteria, what participation entails, and really what that study is trying to understand or learn. And so one of the things that I want to really implore of you all is if you have any contribution to the content of the research studies website for your study, please use language that a lay audience would understand, and that would help us enormously use this as a tool for helping connect community members with studies that they are interested in participating in. And I want to do a time check. Okay, I need to, um, we do adapt based on the venue that we're in, and so we can't always create that sequence or that roadshow roadmap that I showed you. Sometimes we have to use space very creatively, and so we were recently in the Senior Planet venue, and so we had research teams in this open area. The ID CAP team who was enrolling, we had them in a more private space, and we always like to have some space that's kind of a rest stop. If you want to go with this analogy of the roadshow roadmap, having a rest stop, which is a place where community members can truly rest, put their feet up, go through their packet of materials, consider a informed consent form, and we also have conversation starters on the tables that ask them questions to think about what was a medication or a new device that was created in your lifetime that's affected your health and your quality of life, to again, as ways to help them connect research with their own lives. And then we had this nice area here for refreshments where people could get food. So we do flex based on our space. And rather than a research roadmap, we simply provided this as a guided tour about what they could interact with, experiment with, play with, and where they could find each of these technologies during our Age Tech Research Roadshow. We also have an activities card, and if they complete all of these activities and return their card, their name is entered for a 25% or $25 gift card. So I was listening very carefully to Amy's presentation. Okay. So we really want to highlight the positive impact that they can make through participating in research, that research can support healthy aging, and we really try to make explicit the innovations and the new insights that we're learning about aging through the research happening on this campus. That research is a way to have a voice and to contribute to the health of our current and future generations, so to make a difference. We do share resources developed by our older adult research specialists. These are part of the resources that we provide to older adult participants and others that may come with them. This is an example of a decision aid of questions and considerations that older adults created for other older adults as they're considering participating in a clinical trial. We also, I'll stop here. I just wanted to highlight one other thing, is that addressing the digital divide is a really important facet of connecting people to research. And so one of the things that we try to do is make sure we are providing information about affordable, low-cost ways to get internet access. Our older adult research specialists, as I mentioned, provide those guided tours through the research studies website. They also, with permission, can enable accessibility features on people's devices to support them in using devices and being able to participate, for example, in a trial that's focused on using a health app or requires that as part of participation. So we hope that these variety of supports help people. It helps build their self-efficacy, their confidence that they can participate in research and make a positive difference. So if you're interested in participating with us, please take a picture of this QR code. This will take you to our site where there are 3 tabs. The third is where you can fill out a Research Roadshow interest form and let us know you'd like to join us on the road. We are planning to travel to the Eastern Plains and the southern part of the state in the next few months. And I will stop there. Thank you.
Excellent. Thank you so much, Katie. I think this is a great resource. We do have one question in the chat, and if there are more from folks, please keep them coming. Feel free to unmute yourself or submit them through the chat. Are we able to provide study flyers for these research roadshows, or do members of our study team have to be there? I manage several studies that may recruit older adults. Is older than 50 years of age your definition of an older adult?
So yes, we would love to take your research study flyers, your IRB, COMERB approved research study flyers with us. We ask that people do think about, there is some coordination around that because we are engaging specific populations of older adults and want to make sure we're tailoring our materials, those studies that we're featuring, the composition of our Research Roadshow team to be responsive to the population that we are engaging with. So that's just something to consider. We do really highly curate the studies that we feature and think and try to be very thoughtful about that. So for example, when we did a Research Roadshow in Grand Junction in April, we really wanted to make sure that we were featuring studies that people could participate in remotely, or that might only require 1 or 2 study visits over a longer period of time, so that we were really thinking about, we want to connect people with studies that they can feasibly participate in. So that's something. And then, in terms of older adult, NIH CDC defines older adult as 65 years of age and older. At the VA, we have a broader definition because of the physiological and psychological effects of military service. Often veterans physiologically are older than they are chronologically. So we usually use 60 years of age and older. So if it's 50 years of age and older, that's just fine. We'd love to include your study flyers and your team.